Disclaimer: this video should not be used as a diagnosis. If you suspect you may have thalassemia, please consult a certified healthcare professional for a diagnosis. Hello, I'm Dr. Paniz, and today we're going to talk about beta-thalassemia. Thalassemia is a hereditary blood disorder, which means that it can be passed from parent to child and the child would be born with this disease. It is not infectious and cannot be passed on from one individual to another by personal contact. Thalassemia is most commonly found in people from China, South Asia, Middle East, Mediterranean, and Africa. About 1 in 100,000 people have symptoms of thalassemia throughout the world. Let's learn about blood cells a little bit first. Blood cells are made up of 3 major types of cells: red blood cells, white blood cells, and platelets. And today we're going to talk about red blood cells. Hemoglobin is a protein in your red blood cells that help carry oxygen throughout your body. Hemoglobin is made up of 2 beta chains, 2 alpha chains, heme group, and iron. People who are born with this disease cannot make normal hemoglobin. Thus, thalassemia patients often have severe anemia, which is where you lack enough healthy red blood cells to carry enough oxygen to your body's tissue. Patients can also have expansion of the bone marrow because of the body's effort to produce more red blood cells. Anemia and expansion of the bone marrow can lead to poor growth, impaired physical activities, facial and other bone deformities, fragile bone, and enlargement of the liver and spleen. And if thalassemia left untreated, it will lead to death within the first decade of life. The only treatment to combat severe anemia is regular blood transfusions and iron chelation therapy. Chelation therapy is a process of injecting some chemicals to the bloodstream to remove heavy metals and minerals from the body. Blood transfusion is a process of transferring blood or blood products into patient's bloodstream. There are 2 main types of thalassemia: alpha thalassemia, that is due to some genetic defects in the alpha chain, and beta thalassemia, that is due to some genetic defects in the beta chain. And today we will focus on beta thalassemia because it's most common type of thalassemia. Beta thalassemia is caused by point mutations or deletions in the beta globin gene on chromosome 11. Point mutation is when a single part of your DNA is changed to something different. And deletion is when a part of your DNA is lost. This leads to absence or reduction of 2 important parts of the beta chain in hemoglobin. There are 3 forms of beta thalassemia: major, intermediate, and minor. Heterozygous patients carry 1 normal gene and 1 gene for beta thalassemia. Homozygous patients carry both genes for beta thalassemia. Homozygous patients for beta thalassemia may develop either thalassemia major or thalassemia intermediate. Let's meet some beta thalassemia patients. Our first patient is Sam.
Hi, my name is Sam and I have beta-thalassemia major, also known as Cooley's anemia, which means that I've had severe anemia since I was less than 2 years old.
Patients with beta-thalassemia major lack the ability to produce normal adult hemoglobin. Some symptoms include chronic fatigue, failure to thrive, slow growth and delayed puberty, pale skin, poor appetite, jaundice, bone problems, enlarged spleen. Treatment requires regular red blood cell transfusions once almost every 2 to 4 weeks. Our next patient is Joe.
Hi, my name is Joe and I have beta-thalassemia intermedia. I have had gallstones, painful leg ulcers, and thrombosis.
Patients with beta-thalassemia intermedia have hypertrophy of erythroid marrow, which means number of the red blood cells in the blood marrow that are abnormal in size, shape, and organization increases. They also have medullary and extramedullary hematopoiesis, which refers to the production of all of the cellular components of blood and blood plasma outside of the bone marrow. Some symptoms include slowed growth and delayed puberty, bone problems, and enlarged spleen. Treatment depends on how the patient is feeling and their growth and development rate. Let's talk about patients with beta-thalassemia minor. Patients with beta-thalassemia minor can be asymptomatic, which means they do not produce or show any symptoms. The only symptoms that they might have is mild anemia. Therefore, since patients usually do not have symptoms, treatment is not required. Diagnosis can be done by hemoglobin electrophoresis, which is a special blood test that detects beta-thalassemia. Do you or your partner have or carry the thalassemia trait? Contact a genetic counselor to discuss the potential risks to your future children. Thank you for watching.